Apple cider vinegar is a type of vinegar made from fermented apple juice. It is created by crushing apples, extracting the liquid, and adding yeast and bacteria to start the fermentation process. This process converts the sugars in the apple juice into alcohol, which is then further fermented into acetic acid by acetic acid bacteria. The result is a tangy, amber-colored liquid with a distinct flavor and aroma. This vinegar has been known for its numerous health benefits, many of which are supported by scientific research. Its applications extend from digestive health and blood sugar control to weight management, antimicrobial properties, heart health, and skin care. While its benefits are jaw-dropping for sure, the misuse of apple cider vinegar can lead to severe adverse effects. Unfortunately, many people are only aware of its benefits and completely blind to what you must avoid while using this miraculous vinegar. This is why in this video, we will reveal to you things you should never ever do while taking apple cider vinegar. Now, without any further ado, let's get to it. Number 1. Never take it right before bed. You should never take apple cider vinegar right before you go to sleep. This is because taking it before lying down increases the risk of acid reflux. Acid reflux is when stomach acid flows backwards into your esophagus. Your stomach is capable of withstanding that acidity, however, your esophagus isn't. And when you lie down, stomach acid can more easily travel back up the esophagus, causing heartburn and discomfort. The acidity of apple cider vinegar can exacerbate these symptoms. If we take a look at a study published in the American Journal of Gastroenterology in 2016, we will see that it has evidence to prove this. According to the results of this study, participants who consumed apple cider vinegar before lying down experienced a 36% increase in acid reflux episodes compared to those who took it earlier in the day. So, if you are planning on taking apple cider vinegar, make sure to ingest it at least 30 minutes before meals and avoid consuming it right before lying down. Number 2. Never drink it undiluted. Apple cider vinegar is highly acidic, so you should never drink it undiluted. When consumed undiluted, this strong acidity can erode tooth enamel, leading to increased sensitivity and decay. Additionally, undiluted apple cider vinegar can irritate the throat and esophagus, causing discomfort or even chemical burns. A study published in the Journal of Dentistry in 2014 examined the erosive effects of acidic beverages on tooth enamel. In this study, researchers exposed tooth enamel to different acidic solutions, including apple cider vinegar. The study found that undiluted apple cider vinegar led to a significant reduction in enamel hardness by approximately 20 to 30% compared to control samples. To correctly consume apple cider vinegar, you should dilute 1 to 2 tablespoons of apple cider vinegar in a large glass of water, which is about 8 ounces. This reduces its acidity, protecting tooth enamel and the mucosal lining of the throat and esophagus from irritation. Number 3. Never have too much. Excessive intake of apple cider vinegar can lead to a number of health issues. Its high acidity can lead to symptoms of digestive discomfort, such as nausea and bloating. Over time, excessive apple cider vinegar can also lower potassium levels in the body. This is medically known as hypokalemia. A few of its unfortunate complications include muscle weakness and muscle cramps. Acetic acid in apple cider vinegar is the root cause for these symptoms, as it can interfere with the body's ability to maintain potassium balance. A study in the Journal of Clinical Nutrition in 2005 investigated the effects of apple cider vinegar on potassium levels and acid-base balance. Participants consumed 30 milliliters of apple cider vinegar daily for 8 weeks. Results showed a decrease in potassium levels in the blood by 13% and increased symptoms of muscle weakness and cramping in 10% of participants. To avoid these complications, it is best to limit your intake of apple cider vinegar to 1 to 2 tablespoons per day, diluted in water as we explained earlier. Number 4. Never combine it with certain medications. Apple cider vinegar can interact negatively with certain medications, so you should never combine it with other medical drugs before checking first. For instance, it can alter insulin levels or interfere with insulin sensitivity, which can be dangerous for people taking diabetes medication. In addition to that, due to its potassium lowering effect that we talked about earlier, apple cider vinegar can enhance the side effects of medications that also lower potassium levels, such as diuretics and some heart medications. A study in the Diabetes Care Journal conducted in 2004 examined the interaction between apple cider vinegar and diabetes medication. After analyzing the results, it was found out that participants taking insulin and consuming ACV showed a 16% reduction in blood glucose levels, indicating a potential risk of hypoglycemia. Adding to that, a 12% increase in adverse effects was noted among those on potassium-lowering diuretics. So always consult with a healthcare provider before using apple cider vinegar if you are on any medications, especially those for diabetes or potassium regulation. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Never apply it directly to the skin without dilution. Applying undiluted apple cider vinegar to the skin can cause irritation, chemical burns, and allergic reactions due to its high acidity. By doing so, the skin's natural barrier can be compromised, leading to increased sensitivity and potential for infection. By diluting apple cider vinegar with water, you reduce its acidity and make it safer for topical use. A study in the Journal of Dermatology published in 2017 examined the effects of undiluted apple cider vinegar on the skin. It was observed that application of undiluted apple cider vinegar led to skin irritation in 80% of participants and mild burns in 25%. For these reasons, you should always dilute apple cider vinegar with water at a 1-to-1 ratio before applying it to the skin. Number 6. Never use it for a long time without breaks. Prolonged use of apple cider vinegar can lead to adverse effects such as enamel erosion, digestive issues, and altered potassium levels. Long-term acid exposure can wear down the mucosal lining of the digestive tract, leading to dangerous complications such as stomach inflammation or ulcers. Taking breaks can help mitigate these risks and allow the body to maintain its natural balance. A study published in the Journal of Gastroenterology carried out in 2012 investigated the effects of long-term apple cider vinegar consumption on the digestive tract. The results showed that the participants consuming apple cider vinegar daily for 6 months experienced a 25% increase in erosion of the stomach's mucosal lining and a 15% increase in symptoms of stomach inflammation. To avoid this, try to incorporate breaks into your apple cider vinegar regimen, such as using it for a few weeks followed by a week off. Number 7. Never use it as a substitute for medical treatment. While apple cider vinegar is famous for its tremendous health benefits, it shouldn't replace prescribed medical treatments indicated by your doctor. Relying solely on apple cider vinegar for serious health conditions can delay proper diagnosis and treatment, and potentially lead to worse health outcomes. Apple cider vinegar's benefits are often supportive to medical treatment rather than curative to the health condition and should be part of a balanced approach to health, as indicated in an article in the British Medical Journal in 2015. When patients delayed seeking medical treatment in favor of using apple cider vinegar alone, they suffered a 20% increase in complications and poor health outcomes and prognosis. So these were the top things you should never do while taking apple cider vinegar. By understanding these mechanisms, you can use apple cider vinegar safely and effectively, avoiding potential health risks. It is essential to use apple cider vinegar properly and consult with healthcare providers, especially when considering it as a complementary treatment for medical conditions. Now, we want to hear from you. Have you ever done any of these things while taking apple cider vinegar? What complications did you experience? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.